Hello everyone, my name is Jordan. I'm a student in EKU's FMP program. So the question that guided my research in PICO format is, in substance abusing pregnant women of approximately 5 weeks gestation to 40 weeks gestation, ages 18 to 30, how does integrated substance abuse therapy and prenatal care in the form of substance abuse support groups, motivational interviewing, cognitive behavioral therapy, and evaluative questionnaires used once weekly for 1 hour each session compared to routine prenatal care, influence neonatal outcomes by measuring against the defined standard for well-child checks up to 1 year after delivery. This is a relevant population to propose an intervention. Additionally, as you can see by the percentages and consequences listed on the poster, the cost of substance abuse in pregnancy is far-reaching and vast. Healthy People 2020 includes tobacco use and substance abuse as an important health risk related to maternal, infant, and child health. The risk of infant as well as maternal mortality and pregnancy-associated complications can be reduced by providing needed resources such as increased access to quality antepartum care and social support infrastructures for mothers that struggle with addiction pre- and post-conception. Healthy People 2020 also includes that early identification and treatment of health risks such as substance abuse in pregnant women, will promote positive outcomes for mother and fetuses alike. Synthesis of the included literature suggests that utilizing integrated therapy as a treatment modality for substance abusing pregnant women can promote neonatal outcomes and decrease adverse effects. The 5 included studies utilized 4 randomized control trials and 1 prospective cohort study design. For those that utilize the substance-abusing pregnant population, the results suggest that those women who participated in treatment pre- or post-baby had children who weighed 400 grams heavier, mothers who remained pregnant for 2 weeks longer, and were less likely to be admitted to the NICU and have higher APGAR score assignments at birth. Studies that did not utilize the pregnant population still found individuals who participated in treatment to be more likely to attend the sessions regularly, be retained in the treatment longer, and they were more likely to continue these behaviors following detoxification. Bearing in mind these findings from the literature, the proposed intervention of integrating substance abuse treatment in conjunction with prenatal care will be observed in an outpatient obstetrical clinic. Potential participants will attend a program orientation with myself, the primary investigator, as well as 8 professionally trained mentors ranging from APRNs, RNs, doctors, and social workers. Once participants have consented to participate in the study, a tentative schedule will be given to participants outlining the procession and topics expected to be addressed within each scheduled session. This will ultimately depend on the number of completed weeks of gestation due to time constraints. Roughly 6 to 12 sessions in total should be completed throughout the pregnancy in conjunction with the originally scheduled prenatal visit. These visits should only exceed the original time limit by about 20 to 45 minutes, dependent on the type of substance abuse therapy under review. Each participant will be assigned a primary mentor with which they will be remained assigned throughout the duration of the study. This is to establish rapport, accountability, and familiarity within the working relationship. These mentors will receive adequate training in cognitive behavioral therapy, as well as signs and symptoms of withdrawal prior to initiation of the program. The primary investigator will meet with the participant following the routinely scheduled prenatal visits to discuss various topics related to substance abuse, structured around the questionnaires such as the Addiction Severity Index, covering topics such as relationships, safe and effective coping mechanisms for stress, barriers to stay drug-free, motivational assessments, and employment issues. The participants may view videos or hear recordings that aid in the furthering of remaining substance-free while pregnant, or possibly fill out questionnaires such as the State of Change questionnaire, the Childhood Trauma questionnaire, and the Trauma Symptom Inventory for the evaluative purposes of the study. Data will be collected for approximately 1 year. Following the completion of the study, empirical data such as the APGAR scores, mean weight of the neonate, gestational age at delivery, admission to the NICU, and urine meconium drug toxicology results will all be acquired via the medical record of either the mother or the neonate so that we can use those for measures and comparison. Data collected will also be entered by the 8 trained mentors and evaluated for themes utilizing a statistical software data analysis to ensure reliability and validity of measure. It is the hope that as a result of this study, by instilling motivation and supplying participants with the helpful proficiencies, allowing them to deal with life stressors related to substance abuse more efficiently. The burden of consequence often stressed on healthcare from substance abuse will be alleviated and outcomes are promoted for the mother and the child alike.